The night was hectic at the hospital. Emergencies were coming in nonstop, with doctors and nurses running back and forth. But no case that night would be as unbelievable as what was about to happen. Dr. Raphael, a renowned surgeon and specialist in impossible cases, had seen it all in his career, but nothing could have prepared him for the patient who had just arrived. He was a 36-year-old man, apparently healthy, until he suffered a sudden cardiac arrest. By the time the paramedics arrived, his heart had completely stopped. They tried to revive him in every possible way, but the heart showed no sign of life. Dr. Raphael examined the patient as soon as he arrived. The machines confirmed the worst: zero cardiac activity. Protocol dictated that the patient should be declared dead, but Raphael wasn't an ordinary doctor. He had challenged medicine before, and at that moment, he felt he couldn't give up. He made a risky decision to connect the patient to ECMO, extracorporeal membrane oxygenation, a machine that functions as an artificial heart and lungs, pumping blood through the body without the need for a heartbeat. If the decision failed, it would only be a waste of time. But if it worked, the impossible might just happen. Dr. Raphael watched the monitors closely as the ECMO kept the patient's blood circulating. He knew that the machine could keep a person alive for a few hours, maybe a day, while they waited for a compatible heart for a transplant. But what happened in the following hours would challenge everything he knew about medicine. The first 12 hours passed, then 24. The most impressive thing wasn't just the fact that the patient remained alive, but that he showed no signs of deterioration. Normally, a body without a functioning heart would collapse quickly, but for some reason, the patient's organs were functioning almost as if nothing had happened. The medical team began to wonder if they were witnessing something unique. More detailed tests were performed, and then something frightening appeared in the results. The patient's body was beginning to develop new blood vessels around the area where the cardiac flow should have been. "This isn't possible," one of the doctors murmured as he examined the images. Dr. Raphael didn't respond immediately. He was fascinated, but also uneasy. The human body had always shown a surprising capacity for adaptation, but this was something that medicine had never documented before. Meanwhile, the search for a compatible heart continued. If the patient had already survived 24 hours without a beating heart, how much longer could his body endure? Hours kept passing, and what seemed impossible was happening. Right before the eyes of the entire medical team, the patient had already surpassed 36 hours without a beating heart, and somehow his body was still functioning. Dr. Raphael barely left the room where the patient was being monitored. He kept reviewing the tests repeatedly, trying to understand how this man was still alive. "The organs should be failing by now," said one of the nurses, looking at the monitors. But the patient's vital signs were inexplicably stable. It was as if his body was adapting to the absence of a heart, finding alternative ways to maintain blood circulation. Then something happened. The ECMO machine began showing slight variations in blood flow levels. At first, it seemed like a technical malfunction. But upon closer examination, they realized something even more bizarre. The patient's own body was regulating the blood flow, as if taking control of the situation. Dr. Raphael frowned. It didn't make sense. Without a heart, the body should rely entirely on the machine. Yet the patient's blood vessels seemed to be taking over a function that was once exclusive to the heart. Then the alert sounded. A compatible heart had been found. The surgical team was immediately called, and the operating room was prepared. The time for the transplant had arrived, but no one could predict what would happen during that procedure. The surgical team moved quickly, preparing the patient for the transplant. The donor's heart had arrived in perfect condition, and everything was ready to finally restore the patient's cardiac function. Dr. Raphael carefully washed his hands, put on his surgical gloves, and took a deep breath. Even after years of experience with high-risk surgeries, he knew this was not an ordinary procedure. As the surgery began, the first stage went smoothly. The ECMO machine maintained stable blood flow while the doctors prepared the chest cavity to receive the new heart. Then came the critical moment, connecting the blood vessels to the transplanted organ. That's when everything started to go wrong, as the surgeons attempted to attach the donor's heart to the patient's circulatory system. An immediate rejection occurred? "This is impossible," exclaimed one of the assistant doctors. The patient's body was rejecting the heart even before it was fully implanted. Blood pressure levels began fluctuating uncontrollably. A spasm occurred in the blood vessels, as if the body was actively refusing the presence of a new heart. Dr. Raphael ordered the team to stabilize the patient. But at that moment, something even more terrifying happened. The monitors started picking up small electrical impulses inside the patient's chest cavity. It was as if an invisible force was trying to generate cardiac activity, but there was no heart inside his chest. The entire team froze for a moment. What they were witnessing completely defied medicine. Dr. Raphael knew he had to act quickly. If they didn't find a solution, the patient would die. But what was the explanation for what was happening? The silence in the operating room was broken only by the sound of monitors, blaring alarms. The medical team was in shock. How could there be electrical impulses inside the chest of a man without a heart? Dr. Raphael remained calm. He knew that if they hesitated too long, the patient would not survive. But nothing in his career, nothing in all his years of study, could explain what was happening before his eyes. He looked at his assistants and made a bold decision. Stop everything. We're not going to force the transplant. Let's observe what his body is trying to do. The surgeons stepped back, keeping the support systems running, but without implanting the donor's heart. Everyone watched the cardiac monitor screen intently, and then something impossible happened. The electrical signals grew stronger. It was as if the patient's own body was trying to reactivate an organ that was no longer there. Small contractions began to appear in the area where, 2 days ago, the original heart had been beating. "This can't be real," murmured one of the doctors. But Raphael no longer doubted anything. He ordered the procedure's images to be magnified, and that's when they saw it. A pulsating structure was beginning to form inside the patient's chest. It wasn't a complete heart, but living tissue, reacting and moving as if trying to rebuild the lost organ. Time was running out. If they didn't make a decision, the patient wouldn't survive. Raphael looked at the donor heart on the surgical tray, then at the patient's chest cavity, and it was then that he made the boldest decision of his entire career.